Hi, welcome to my channel. This video is about how I almost lost my life during childbearing. Again, welcome to my channel, Live Documentary. Live Documentary is a channel where we talk about all types of life experiences that can help others out, that we can learn from, that we can actually use as a practical knowledge to address our own life experiences and to have a better outcome. In this video, I'm going to talk about how I almost lost my life during childbirth. A lot of times we take childbearing or giving birth as something very simple. Yes, for some women, it can be very simple. It can be, just as easy as just, birthing a child without any complication. But in this video, we're going to talk about serious complication. In this video, we're going to talk about complications that can actually, cause a permanent damage, complications that can actually, take a person's life during childbirth, which we may not really take seriously if we've witnessed other women just giving birth without any complication. So in this video, I'm particularly going to look at childbearing in Nigeria. Giving birth in a well-developed country like a Western world may be a little bit different. But as a person in general, you still need to advocate for yourself. You want to make sure that you're letting the doctors, the nurses, everyone taking care of you medically know your history. So that way they will be more proactive in making sure that they do the necessary tests so they can diagnose you properly. In this video, I'm going to use myself as an example. And that's why the topic is why I almost lost my life during childbirth. It's important that I share this story because a lot of times, even our husbands do not understand the gravity of giving birth. You may even be compared to other women. Oh, this other woman just gives birth just like that. Easy. They don't have all these symptoms. But why is it that you have all this issue? So again, some women do give birth without any issue. Every woman is different from the other. Some will have some complications for any reason it may be. In this video, we're going to talk about how I personally almost lost my life trying to give birth to my oldest child, my first child. So when I became pregnant, I became pregnant for my first child at a very young age. This may also be a factor in what happened to me. According to some studies, studies have shown that this could happen in either an older or a younger age, depending on what research or what where you're getting your information from. So when I got pregnant, before my pregnancy, I was underweight. And as soon as I got pregnant, within 3 months of my pregnancy, I doubled my weight. And within 6 months, I had tripled my weight. On top of it all, I was throwing up excessively. I had severe nausea and vomiting. I couldn't handle any smell. Every time I smelled or perceived any odor, it doesn't matter what it is, I immediately I can't control my nausea. I was throwing up non-stop. So when this started happening, I remember I would go back to my doctor, and this was, by the way, in Nigeria. And that's why I'm particularly saying Nigeria, because a lot of times Nigeria does not have the equipment. Nigeria does not have the resources. Nigeria does not have certain facility to take care of certain types of patient. So this hospital I was going to, my husband, it was actually my husband's jobs insurance company from his job that uses this particular hospital. But this hospital has no business, taking care of a pregnant woman, how much less a pregnant woman with complication. So I remember I would go for my antenatal care, and once I get there to my antenatal care, I remember they were telling me, oh, your blood pressure is high. Oh, you eating too much salt. Oh, I remember my blood pressure at one particular day was 200 over maybe 140. Something crazy like that, I can't remember. But really high. The top number was over 200. And all I was told, of course, I wasn't a nurse. I didn't have any nursing background because I did all my nursing schooling here in America. So, of course, I didn't have a clue what they were talking about or how dangerous it was. But they will, give me my antenatal pills, like my vitamins, supplements, and they will send me back on my way home. And I will go back home in a critical condition, in a condition I should never be going back home. This would have been, if I was in America, this would have been a medical emergency. But I was sent home. I was told that my legs are elevated because my legs were swollen. As a matter of fact, I was swollen from my head to my toes. Once you look at me, you would notice that I wasn't in a good medical condition. I was swollen all over the place. So of course, I continue to have severe headache. I continue to have severe nausea, vomiting. I even, towards the 7th month, I even started throwing up blood. I would throw up clots and clots of blood. At some time, I had an opportunity within my 7 months pregnancy. I had an opportunity to come to America. That was my first visit to America. And my plan, or the plan, was for me to stay. But for some reason, I'm not going to go into that in this video. I may have to do a video if I do decide to share that story in a later video of what happened. But I ended up going back to Nigeria after 2 weeks of being in America. So I went also a very big risk of getting back in the plane with a high risk pregnancy, and I went back to Nigeria. So around the 9th month, I'm not exactly sure around what time exactly, it looked like I had the symptom of actually having the baby. I went back to the same hospital that had been, taking care of me just before I left for that short 2 weeks. And the doctor, of course, began to treat me again, and they had admitted me. My husband stayed with me. He wouldn't leave my side. He actually was sleeping on the floor of the hospital. He was actually sleeping on the floor of the room that I was placed in, and I had so much pain. I had a lot of pain. In Nigeria, I don't know about now. This was like in late 90s. In Nigeria, I don't know about now if they are doing any epidural or whatever they do for pain. So I had severe pain. I just had severe pain on my lower back. I remember just being on the bed, laying on the bed, and I just kept on, screaming. It was so painful. And I also have a very low tolerance of pain, compared to some people that will have, high tolerance to pain. So I was just screaming, and the last thing I remembered is I screamed, and I just didn't remember anything else until I had my baby. So my husband told me, what happened, how I passed out. Actually, I had a seizure. I had a full-blown seizure before I passed out. And my husband gave me the story, which I'm not going to talk about in this video, which I can go in details in a different video of how I actually gave birth, without, with assistance from the nurses and the doctors. My husband did tell me that they did call in a specialist to do a C-section, but by the time the specialist came, the specialist said I could actually have the baby naturally, which I did without being conscious. I don't know how that happened, but I did have that baby. And of course, the next day, I was actually put on another risk of, I remember the second day my mom was with me, and I believe this was before my mom came in. I was with the baby, and then I remembered I felt like urinating, and I got up to the nurses allowed me to get up by myself to go urinate, and then I went back to urinate, and by myself, and then I started passing a lot of clots of blood, and I started bleeding at that time, and then I almost passed out, and this was when my mom came in to my room and saw me and helped me back. So again, this is something else that was done that wasn't supposed to have been done. If it was in a more established environment where they know exactly what the complications could be, they wouldn't have allowed me to go pee by myself. Again, that's why I'm focusing this on Nigeria. If you are giving birth in Nigeria, if you are having a baby in Nigeria, if you have to be mindful of what you're doing. If you're just going to a hospital because this is the only hospital you can afford, you want to be mindful of what can happen to you. If you have a spouse, your husband needs to be your backbone in this particular situation. If you don't have a husband close by, you need your relatives. Someone needs to be there to look out for you. So they got me back to the bed. Long story short, they gave me a blood transfusion. This was my first blood transfusion because apparently I was bleeding a lot and I had to take blood. So this brings me back to the reason of what actually happened to me. So when I was pregnant, even while I went through my earlier stage of pregnancy, I was actually having displaying the signs and symptoms of preeclampsia. Preeclampsia is a condition in pregnancy that is mainly recognized or diagnosed as high blood pressure in pregnancy. It also has protein urine, where a pregnant woman would have protein in their urine. In a normal circumstances, there shouldn't be protein in the urine, but the reason why in a complicated pregnancy, like in a situation of preeclampsia, the reason why there will be protein in the urine is because the kidney is actually failing. So kidney processes the proteins, and kidney processes one of the things that the kidney will process is the protein. And for the fact that the kidney is being detected in the urine means that the kidney is not doing its work by actually filtering and breaking down the protein or any whatever substance it may be. So in this particular situation, is protein in the urine. So I've actually watched a video some time ago of a pregnant woman that lost her life, and she had gone to the hospital, and then they apparently did the urine test, which detected protein in her urine, but nothing was done about it. So I'm not sure if the hospital knew what that actually meant, because I believe that pregnant lady at the time was going through preeclampsia, and which wasn't addressed, and at the end of the day she lost her life, which could have been prevented. So protein in the urine and high blood pressure in pregnancy is a sign of preeclampsia, and this is a medical emergency in pregnancy. It needs to be taken seriously because someone can lose their life. This is a serious emergency situation. If preeclampsia is not addressed, it then turns to eclampsia. Eclampsia is where a situation or a condition where preeclampsia is not addressed and it advances to eclampsia. And in eclampsia, you actually have the full-blown seizure where you seize, and this can actually cause a traumatic brain injury to either the mother or the child, especially the child. It can also cause a condition or a situation where the mother and the child could lose their lives. So again, I was opportuned to have my husband right there in the room with me. And so when I seized, because there was a nurse there too, but apparently the nurse was sleeping. But even if the nurse was awake, they wouldn't have a clue because they were not equipped. They were not certified. They wouldn't know what it was about. Even the hospital that I stayed at, the doctor didn't have a business with having patients that are pregnant or giving birth in that hospital, because they didn't have the right resources, the right training, and the right equipment that they needed for a complication or when a complication arises. So again, preeclampsia, the signs could be excess weight or gaining weight in a very short amount of time, which was what happened to me. At the time we looked at it as, oh, it's just this pregnancy. I had a lot of swellings in my leg. I have a lot of swellings, generalized swellings all over my body. This is also a sign that my kidneys were not working properly. I also had that excessive, vomiting. I also had severe headaches. Of course, my blood pressure was like over the scale of the blood pressure equipment. Of course, because it was not addressed properly, I went into eclampsia fully. So the reason I'm doing this video is a lot of times we do not know about preeclampsia and eclampsia. I went through preeclampsia and eclampsia without even knowing what it was. All we knew is that I could have lost my life and that it was a miracle I was alive. It was a miracle my child was alive. We took it like, oh, it's just one of those complications. I didn't come to know about preeclampsia and eclampsia. I didn't even come to know that I'd been a survivor of preeclampsia and eclampsia until my second pregnancy, where I was going through the same thing. Again, I was back in Nigeria because I had gone to and fro from America to Nigeria because at this time, my husband was still in Nigeria. But we came across a nurse that actually knew what that was, and when we were telling her my history, she knew what it was. Thank God, when I eventually went back to America to have my baby once it was closer to the time. And it was well managed now that we knew what it was the first time. And of course, coming to an environment where there is resources, I was also able to give my history. So the reason again for this video is that if you are pregnant or within the childbearing age and you most especially live in Nigeria, please look out for yourself. Let your loved ones look out for you. If you're throwing up a lot, having a severe headache, high blood pressure in pregnancy, especially when you don't have previous high blood pressure, and if your legs are swelling, yes, sometimes a normal pregnancy, there is some kind of swelling. But I'm talking about everything being excessive. Yes, there's some kind of headache, but excessive headache, excessive throwing up, excessive vomiting. Please look into it. Please do not take it lightly. If they say they found protein in your urine, please, this is life-threatening, not just to the baby, but also to the mother. Please make sure you are addressing this. Thank you for watching this video. And please, if you like my videos, subscribe. Please give it a thumbs up if you like this video. Also, leave your comments. Your comments are very important to me because I can see what questions you have or what experiences that you have. Share your experiences so others will also know. Thank you again for watching. Bye for now.